welcome back. Our first guest is not a stranger to the show. Dr. Abayomi Ajayi is the Chief Executive Officer of Nautical Fertility Center and also the founder of Endometriosis Support Group and co-founder of the African Endometriosis Awareness and Support Group. And also he's convener of Dr. Abayomi Ajayi Physicians Mentoring Program, and also has established the Fibroid Care Center, which of course is for the treatment of benign gynecological issues and so many other things that affects. Well, welcome to the show, sir.
Thank you so much.
I can't begin to exhaust
your extensive resume.
Your extensive resume. But first, let me ask you. I mean, it's yellow. What's happening? There's music, there's medicals, and there's the color yellow. What is going on? What's happening?
Wow. Yes. March is the month that is dedicated to endometriosis awareness all over the world. Okay. And yellow happens to be the color for endometriosis awareness. So, and we're trying to use music to propagate this awareness.
Okay, but before we come back to that, what are your thoughts on Man of the Year? Because we're at the Silver Man of the Year.
Oh yeah, great. It was very good, and like I said, it's one thing that I support wholeheartedly, because we don't have to wait for people to die before we start recognizing them and stuff like that. So, yeah, it's always a welcome development as far as I'm concerned.
Okay, that's just by the side. But talking a bit about endometriosis,
endometriosis.
That's a way of
people.
Yeah, that's one of the disadvantages that so many people. But tell you what, it's gotten a lot better.
Okay.
About 15, 18 years ago when we first started, it was something that nobody could pronounce. And then it was felt very lonely. I was only
wow.
Okay, but for the layman out there really though, what is endometriosis?
Yes, thank you. Endometriosis is commonly a painful condition that results as a result of the occurrence of the inner lining of the uterus, what we call the endometrium, in places where normally it should not be. This is what I mean. Every month, a woman sheds the inner lining of the uterus during the menstrual period. Now, for some reasons, this area that is supposed to be shed now wanders into some other places where it's not supposed to be. And the funny thing is that this implants, that's what we call them, or the endometrium that has misgrowth, now also behaves like the normal endometrium wherever they are. And sometimes they're commonly around the uterus. So they are on the ovaries, on the tube, sometimes in the intestine, but very rarely they can also wander even away from the pelvis to the chest and even to the brain, but very rarely.
What are some of the symptoms and how is it diagnosed?
Good question. Yeah, that's why I took pain to explain what it is that because the symptoms usually will follow where this implant happens to be.
Okay.
And so let's imagine for a minute that it's this endometrium is on the ovary, which is probably one of the commonest sites where it is. So it means every month this endometrium behaves exactly like the endometrium which is normally placed. So it builds up, it sheds. And don't forget now it's inside the abdomen.
Okay.
So that means it's like bleeding into your abdomen, because that blood cannot now come out, unlike the normal endometrium that comes out through the cervix, through the vagina, and then is shed. So what happens is like you're now bleeding inside wherever that endometrium is. Yes. And so that's why most of the time it's painful, because the body tries to control this blood by trying to arrest it. There is something in the abdomen that is called the policeman of the abdomen, which anything that it says that is not normal tries to go there to arrest the situation. It's like a mopo, tries to arrest the situation. Now, so it does that, but this happens every month. And after a while, of course, the chap gives up.
Yes.
And so we have, it's like the blood now, you have scar tissue in the abdomen, and then the organs in the abdomen get matted together. And so the pain could result from either these implants are on some things that are delicate, even some on nerve tissues, or sometimes it's because the organs now, because they are matted together, they can't move as they normally move. For example, during intercourse. So you see a lot of them having pain during intercourse. Some of them having pain when they are moving their bowels, because the bowels are matted together. Yeah, or sometimes even when they are urinating. So pain is not one of the cardinal things, but some people don't have pain at all.
Okay.
And that's why it becomes very confusing. So other things can also come in. You can be bleeding irregularly or bleeding abnormally, let me put it that way. So it can be heavy bleeding. Sometimes some people bleed from unusual places, either the umbilicus. If it's on the umbilicus, it could, even if you're on the lip, you might bleed from there.
Oh, wow.
Yeah, so it's, and that also colors the whole thing. And for some people, if it's in the on the lungs, that means sometimes they might be coughing out blood.
Oh, wow.
Okay.
And so it looks like tuberculosis, you know. Yeah.
Does it affect a woman's ability to get pregnant?
Oh, sure.
And, yeah.
So that's also a big cardinal point, symptom of endometriosis. For us, most of the time until recently, because most of these women were not diagnosed. So the only time we see them, we started seeing them, I mean, for example, we started doing this campaign in 2005. And what made me to start was because we were seeing a lot of them in the infertility clinic, and the diagnosis was just not being made. Okay. So because of this matching together of organs, it's possible that the tube and the ovary have come together. And then apart from that also, because the blood is in the pelvis, it tends to affect the function of sperm and the function of eggs. So infertility, about 40 to 50% of women who have endometriosis have problems with fertility. But that also means another 50% will have babies. Will have babies.
Interestingly, are there treatment options for this?
Yeah. Well, let's start from saying that it's not a curable condition.
It's not a curable condition.
But it can be treated.
Okay.
So, and that's one of the problems again. And the fact that, again, that there's so many symptoms, you know, there's usually why the whole world is talking about awareness for endometriosis is to increase the diagnosis, early diagnosis, because endometriosis is a condition that does not have, it's not like malaria, that if you have fever, you have headache, you're likely to have malaria. Two people might have endometriosis and they have different symptoms because it depends on where the implant is. Okay. So, and that also makes it very confusing for doctors who are not thinking of endometriosis. So in advanced countries, sometimes it takes about 8 to 11 years before diagnosis is made.
Oh, wow.
We need to take a quick break.
Sure.
We were having a great time talking about endometriosis, and we have Dr. Abayomi Ajayi in the studio. Please, we'll take this quick break and we'll be right back. All right, welcome back. And yes, we still have Dr. Abayomi Ajayi, who is giving us a rundown and giving us a brief, not brief, detailed explanation about endometriosis, its treatment, how it can be managed. But yes, specifically talking about some of it, what are some of the treatment options? Because I've heard cases of women who've gone undiagnosed for years and they had a lot of diagnosis, but at the end of the day, they finally got. So how can, what is the proper treatment procedure, or, you know, for people who have it? Okay,
thank you. The first thing, of course, is to make a diagnosis, all right? So we start from the history, okay? History is very important, especially in endometriosis, because sometimes what gives it away is that most of the problems that the woman has, they're made worse during a menstrual period. And that might just be the clincher, okay? So it's very important for the doctor to know the last menstrual period, and whether these symptoms are related, because so many women, have these complaints and the doctor says it's in your brain, I can't find anything here. And it's true, he can't find anything, but she has endometriosis. So history is very important, examination is important, especially the pelvic examination to see, because sometimes that might just be the thing. You just do what we call a bimanual, a vaginal examination, and you touch a spot, the woman jumps off the table. That's a lot of pain. That might be something to tell you that, look, wait a minute, what is that something I'm missing here? And then again, sometimes you have to do, all the time you have to do imaging. Either you're doing ultrasound or, but we know that the level of ultrasound practice in Nigeria is not very good. So very many people still miss it on ultrasound. So now MRI, fortunately, is getting more common, and MRI might also help. But there's some kinds of endometriosis that MRI itself will not even make it, will not diagnose. So we used to do a lot of laparoscopy. Laparoscopy is like pinhole surgery, where you have something like just like a size of a viral and put it under and see this. But what we're saying now is that using laparoscopy only for diagnosis of endometriosis should be discouraged, because we want to reduce the number of times that you actually go into that woman's abdomen, especially women in their reproductive age, because most of the time you cannot go in, come out without having scar tissue, and you might just be making it worse. So a lot of emphasis is going on clinical diagnosis of endometriosis. Or when you've now made a diagnosis, that is, you can now triage what kind of treatment do we want this patient to have. This depends on who are we treating. Does she want to have children? Okay. If a woman wants to have children, then you have to investigate not only her, but also her partner. Okay. But if she's single, she's not thinking of having children, then you could use drugs, and then surgery can also be something that you can consider. But of course, you must always start with this least invasive. So drugs will be your first thing, and drugs could be analgesic. Okay, some of the over-the-counter analgesics can be done, and if you are successful with this, then you now start looking at treating that, because treatment of endometriosis should be tailored according to individual needs. Okay, but analgesics alone, they don't take anything away. So you're thinking of either introducing hormones to such a patient, and this could be in terms of oral contraceptive pills. Sometimes you could start using progesterone only drugs, like even to the point of using, there's a IUCD or intrauterine contraceptive device that is impregnated with progesterone, which we call Mirena, might also be of help. So it depends on what this patient wants. If it's pain that you're trying to take control of, then that might be of use. Other drugs might also be used, but some of these drugs will always affect your menstrual period, so you might stop menstruating. Things like GnRH analogs and aromatase inhibitors. So there are drugs that we can use. With
all these treatment options that you've mentioned so far, I'm sure that a lot of people are wondering, with the age we have cancer in today's world, I'm sure that people are wondering, is endometriosis, can it be cancerous?
It's not cancerous, but there's some cancers that have been found to be more common in people who have endometriosis. Not because endometriosis is cancerous, but I think because the risk factors of such cancers are the same as the risk factors of endometriosis.
Well, let's look at some of the activities. The reason why you're wearing yellow, and it's the yellow season, I must say. Just tell us about the activities that are great for the awareness of endometriosis.
Wow, thank you. On the 25th, we're going to have a dance at the beach just to interest young people. You know, we also have this secondary school essay competition that we've been doing for the girls in the secondary school, because we've seen that about 60% of patients, the symptoms start before they are 20 years old. And that means majority of them, the symptoms start when they are in secondary school. So bringing the knowledge of endometriosis to girls in secondary schools is very, very important. Because sometimes, like I said, if you're seeing a doctor who doesn't know anything about endometriosis, it might prolong the diagnosis. But if the young girl knows, we now have some advocates, some young girls who are advocates of endometriosis, now who can even tell you what endometriosis is like. So for such, then that's what we're doing.
So what
all
kind
this
of dance
for young
are we going to? What kind of dance is going to be there?
Well,
I'm sure you're going to be dancing too at the same time.
Well, I try. We were thinking of doing rumba before, but I think we stepped it down so that we won't have to have ambulance. But this is going to be freestyle. Oh, sure. Can you do anything with that such? If you want the young people to be interested. Yeah.
So when is it happening? What days?
Yeah, it's on the 25th of this month. We're part of the endometriosis awareness.
Okay.
And then also we're joining the World Endometriosis Society to do this program. That will be an online thing. We've been doing that for quite a while now. Okay. And so, yeah, that's the thing. It's just to have fun at the same time. Drive the message down, especially to the audience that is most concerned.
It's really nice to talking about this because I know a lot of women have really detailed experience. For the longest of time, they didn't. But what are some of the lifestyle changes, just to wrap up, that women can imbibe to control endometriosis for those who have?
Yeah, I think exercise, you can't go wrong with exercise. Okay, anything that is painful, doing a little bit of exercise will help you, because exercise releases endorphins, and that might help your mood and everything. Because sometimes these people are misunderstood, they are misdiagnosed, and they are mistreated. So parents who have 4 girls, and then there's only one of them who every month when she's menstruating, the whole world comes to a halt. Sometimes the parents are the girl's greatest enemy because they don't understand what's happening. So such people, exercise will help a little bit. Hot water bottle never fails. But more importantly, things like acupuncture will also help. Yoga, if you're in that build, but also joining a support group. We have not so much taken advantage of support groups in Nigeria, because but it's like a fellowship. It's just like a gathering of people who have the same needs, who have facing the same challenges. So that's also a very important aspect of lifestyle changes. Of course, caffeine, alcohol.
Stay away from it. Okay.
Better.
Thank you so much, Dr. Abayomi Ajayi, for coming on the show and giving us a detailed explanation of those who are going through it. And I'm sure that for those who might be facing it, they need to get tested and see a good doctor. And if they want to see you also, how can they reach you too? They have to see different people before they have to see you.
No, telephone never fails.
Telephone, yes, never fails. All right, thank you so much for coming on the show. It was really nice having you. And like we always say, spread the word and spread awareness and go yellow. A couple of people are wearing yellow, so just a pity I didn't wear yellow because he's wearing yellow though. But thank you so much for coming on the show.
Thank you.
All right,
thank you for having me.
Yeah, so we'll take a break. When we come back, we still have more for you on the show. Don't go anywhere.